Hi there, my name is Jessica Stockner, and I'm submitting my Depression PowerPoint presentation for Stacey Ingram's Structure and Function of the Human Body course. Depression is a common but serious disorder that affects millions of people around the world. It receives a lot of stigma in today's society because people who have not experienced depression will make instant judgments without educating themselves about what's causing a person to experience depression. Depression is an illness, it is not a choice. All people experience moments when they are feeling sad or blue. It does not mean it is an indicator of depression. However, if these feelings last more than a couple of weeks, that could be a sign of depression. That is why it is important to recognize the signs and symptoms of depression early as possible, to find ways to treat it, to make sure it doesn't cause long-term consequences to your health. Now, depression varies from person to person, but these are the common signs and symptoms that a person will experience, such as sadness, tiredness, trouble focusing or concentrating, anger, irritability, frustration, loss of interest in pleasurable or fun activities, sleep issues as far as sleeping too much or not getting enough sleep, no energy, changes in appetite, anxiety, isolation, trouble thinking clearly or making decisions, poor performance at work or school, feeling guilt, suicidal thoughts or tendencies, experiencing pain like headaches or muscle aches, and also drug or alcohol abuse. Despite the numerous amount of research, it is not yet known what is the exact cause of depression. There are many different factors of causes of depression that are involved, such as biological, genetics, situational, and hormonal. And we will actually go over each of those. With biological, depression can cause physical changes in the most complex organ in our body, and that's our brain. There are three parts of the brain that are affected: the hippocampus, the amygdala, and the prefrontal cortex. The hippocampus is located near the center of the brain, and it stores memories and regulates the production of hormone called cortisol. The amygdala is located close to the hippocampus in the frontal portion of the temporal lobe. It helps process emotional reactions. The prefrontal cortex is located in front of the brain, and it is responsible for regulating emotions, making decisions, and forming memories. Now, to follow up about cortisol, the body releases cortisol during the times of physical and mental stress, including during times of depression. Problems can occur when excessive amounts of cortisol are sent to the brain due to a stressful event or a chemical imbalance in the body. The long-term exposure to increased cortisol levels can slow the production of new neurons and cause the neurons in the hippocampus to shrink. This can lead to memory problems. And it can also cause the prefrontal cortex to shrink as well. And the amygdala becomes enlarged and more active as a result of constant exposure to high levels of cortisol. An enlarged and hyperactive amygdala, along with abnormal activities in other parts of the brain, can result in disturbances in sleep and activity patterns. It can also cause the body to release irregular amounts of hormones and other chemicals in the body, leading to further complications. Many researchers Many researchers believe that high levels of cortisol play a big role in changing the physical structure and chemical activities of the body. Depression is also caused by a disruption of chemicals in the brain, most notably serotonin. Serotonin is a natural mood stabilizer and a chemical that helps sleeping, eating, and digesting. It impacts every part of your body from your emotions to your motor skills. Serotonin in the brain is thought to regulate anxiety, happiness, and your mood. Low levels of serotonin in the brain may cause depression. Depression is more common in people whose blood relatives also have this condition. You may have a higher likelihood of experiencing a depressive disorder at some point in your life if you have a family member who is also or have suffered with depression. The exact gene involved in this is still unknown. Any time of trauma, big change, or struggle in life can trigger a cause of depression, such as losing a loved one, being fired from a job, having financial troubles, or undergoing a serious change can have a big impact on people. Serious or chronic illness, such as cancer, stroke, chronic pain, or a heart disease. A traumatic or stressful events, such as physical or sexual abuse. And also someone who is experiencing bullying. For example, for situational. PTSD is a form of depression that occurs after a serious situation in life. And an example of PTSD is also diagnosed in soldiers who are returning from war. It can also occur as a result of childhood trauma, seeing something life-changing or scary, being abused or assaulted, a serious car or other accident, and being diagnosed with a life-threatening condition. Changes in hormone production or functioning could also lead to the onset of depressive states. Any changes in hormone states, including menopause, childbirth, thyroid problems, or other disorders, could cause depression. With postpartum depression, mothers develop symptoms of depression after the birth of their child. While it's perfectly normal to be emotional because of the changing hormones that occurs within the body, postpartum depression is a serious condition that women experience. Most cases are mild for several weeks and are easily treated with medications and talk therapy for 6 months or less. However, without treatments, the long-term effects of depression may lead to severe chronic conditions. That can be being diagnosed with a chronic mental illness, substance abuse. These behaviors can lead to liver damage, kidney failure, and death by accidental overdose, cardiovascular damage, and the long-term consequences would be suicide. In order to manage your symptoms of depression, seeking help from your healthcare provider is the first step of getting treatment. The physician could do a full examination, including collecting your medical history. Physicians can also refer you to see a specialist for psychiatric evaluation. You could be prescribed with antidepressants, receive psychotherapy. You can also try lifestyle changes and home remedies, such as exercising, eating healthy, participating in activities. Those will help you to manage your symptoms of depression. Well, okay guys, that was my depression PowerPoint presentation, and listed here are my references. Help yourself to check out the websites, and thank you very much and have a nice day.